How are you doing today?
I'm okay.
Alright, so what are you here for?
I just want to know a little bit more about my options for birth control.
Have you heard about the Implanon?
No.
It's a hormonal implant, and what it is a progesterone hormonal implant, and they insert it into your arm right here. Some of the benefits of it include that it's a one-time thing. What they do is that it's a surgical procedure. They apply a local anesthetic, and it's about the size of a matchstick. Place it into your arm, and you no longer have to worry about birth control for up to 3 years.
So, what's the catch? Like, what are the side effects?
Well, some of the side effects include, so like most birth controls, you might get a bit of dizziness, you might get weight gain. Sometimes, if you're a smoker, which are you a smoker
I'm
by the
not a
way?
smoker.
That's good. No, smoking is bad for you. But if you're a smoker, you might have a risk of blood clots and therefore heart attacks. But we recommend before you take the Implanon that you do not smoke. That you at least give us 4 weeks notice and try to stop so we could apply smoking cessation for you. And the way how it works is that it will allow for the buildup of a mucus plug in the vagina so sperm does not get into the uterus. It also helps to, well, when you have your menstruation, the lining of the uterus builds up and then it sheds. So it prevents the development of the lining on the uterus. So there's no, usually women say they have no period or there's like minimal spotting or things like that. And also, you do not release any eggs either. Yes.
So, how much does it cost?
Well, if you have insurance, your insurance should cover all, if not, then most of the cost. However, if you don't have insurance, it's an upfront fee of about $400 to $800. Yes, but it's 400 to 800 for 3 years. Whereas if you were to choose the pill over a 3 year time frame, that could be as much as $1,800. So it actually works out to be a bit cheaper.
Oh,
Yeah.
okay, well, that makes sense.
Yeah.
Um, so, are there any other, like, advantages to this in comparison to, like, the other options, like the pill or anything?
Well, I mean, with the pill, you have to remember to take the pill every day at the same time, no matter where you are. However, with this, say that you're like in a very romantic, passionate moment and everything with your boyfriend or husband or whomever you're with, and you don't have to stop. They're like, wait, let me take the pill, or wait, I don't have a condom. You can just like keep on and not ruin the moment because you never have to remember it. It's always in your arm. It's just a quick like 2 minute procedure.
Is it, you said it was a surgery, is it painful?
No, I mean they apply a local anesthetic. If you've given blood, it's about less pain than the needle for giving blood.
Wow.
Yeah.
So, what if, like, years down the road I decide I did want to get pregnant? Am I going to have fertility problems with this?
No. Well, you mean if you did want to get pregnant years
Yeah.
down the line? Yeah. So years down the road, if you decide that I want to have a baby, then you just simply ask us to take it out, and you could quite frankly have a baby that same night.
Oh.
Yes, yes, you can. Yeah, women have reported that shortly after removing the implant, it's been quite easy for them to conceive. Yes.
Okay.
Yeah. The only warning that I would say with the implant versus say using a condom is that the implant does not prevent STDs. It just prevents having a baby.
Oh, sure.
Yes. Do you have any more questions or anything?
Um, I've heard a little bit about, like, what are they called? Like, IUDs?
Yes.
What, would that be a better option?
I don't really recommend an IUDs because IUDs do occasionally have a history of leading to infertility or leading to complications during and trying to conceive. And even the hormonal shots, sometimes it takes a while for you to be able, there's a time frame in which you cannot conceive, even up to a year or more. But with the Implanon, you could immediately have a baby afterwards.
I see. I don't know. I think you covered a lot of my questions already.
Oh, that's great.
I guess I feel pretty good about it.
I'm glad you do. And I guess the only thing that I would advise is that if you're allergic to any of the medications for like the local anesthetic, then just let us know. And also, if you had, or if you had breast cancer or certain cancers, that it may react negatively to the progestin and to the hormones in the Implanon.
Oh, does it react negatively with any other medications?
No, it's fine with most other medications.
So if I'm like on an antidepressant, I'll be okay.
Yeah, you'll be fine. Yes. Alright. So it sounds like everything is okay. And if you ever want to have the Implanon, then just let me know, and we'll just do a physical and we will schedule it. It's a really short procedure.
Great.
Alright.
Well, thank you, doctor, for your time.
Yeah, no problem. Alright, have a nice day.
You too.